The invisible enemy. This is endometriosis.
Debilitating. Relentless.
Excruciating.
Isolating.
Misunderstood.
Endometriosis 1 in 10.
I would describe the pain when it's bad as being a kind of pain that makes you feel physically sick.
Your whole of your wombs, everything, someone's literally just grabbed it and twisted.
It's a chronic pain that no one understands, doubled up and unable to stand alone, bouncing from doctor to doctor before you get a diagnosis. It's not a new condition, but it's still barely understood and often not recognised in women suffering for years. Tissue similar to that of the lining of the womb starts growing in other places, such as on the ovaries, fallopian tubes, and on the outside of the uterus. These cells react in the same way as those in the womb. The tissue builds up and then breaks down and bleeds with the menstrual cycle. Unlike the cells of the womb which leave the body through the period, this blood has nowhere to escape. It becomes irritated, inflamed, and painful. In the UK, 1 in 10 women have endometriosis. Worldwide, that's 176 million. A condition as common as diabetes, yet 54% of people don't even know what it means. For many women, the first time they received their diagnosis was the first time they heard the word that would forever change their lives.
I was 18 at the time, so it was like, what the hell is this word? Never heard of it in my life, had no idea that there were so many people out there that were suffering from the same thing that I was.
But this relatively unknown condition has begun to feature more predominantly in the mainstream media. When left untreated, it can cause irreversible damage. Some of its most commonly known side effects include infertility, nausea, and painful sex. Sirona Health is a virtual health platform centered around supporting women with chronic gynecological problems. They've recently released an app for personalised endometriosis care and community support.
Can you tell me about the research that you've done and what you found from it?
The journey today looks very fragmented for a typical patient with endometriosis. The fact that there wasn't a specific platform for them to use, and a lot of these aspects in the patient journey is very poorly served today as it stands.
The app allows women to track their symptoms, get personalised health insights, be part of a community, and have access to expert help.
It wasn't just kind of putting together just random sources. It very much came from speaking to gynecologists, speaking to obviously our research partners, and speaking to those with endometriosis as the condition itself, and trying to get all the different viewpoints and combining it all into one.
I visited the Portland Hospital for Women and Children in London, a private clinic specialising in women's health. One person who regularly deals with women on their endometriosis journey is Dr. Carolina Afors, a consultant obstetrician and gynecologist at the clinic.
Things that you and me perhaps take for granted, like going to the shops and going for a walk with friends, patients with endometriosis can't do that. And it's potentially for at least a couple of days per month where they may be bedbound. So obviously that can have an impact on their mental health. So they're probably at a higher chance of suffering with things like depression and anxiety.
25-year-old Lauren struggles with crippling anxiety brought on from her endometriosis symptoms. This has left her unable to enjoy a healthy sex life.
There was a point where my partner and I were having sex and we just had to stop. I was bursting into tears. I was in so much agony. And I just had to walk out the room and curled up in a ball and cried. I remember just thinking, what the hell is wrong with me? It's had a knock-on effect on my relationship and my mental health, even after the diagnosis. I now suffer anticipatory anxiety when it comes to sex because of that traumatic experience that I had before. I've been advised that if I did want help with that as a side effect of the endometriosis, I would have to go and find and fund counselling for myself.
Like many other women in her position, Lauren's journey to diagnosis was long. She was actually misdiagnosed at first, with doctors removing her appendix, thinking that appendicitis was to blame for her pain. Lauren's misdiagnosis isn't a rare occurrence. Many women face years of trial and error treatment before their condition is identified. Every single woman I spoke to said that at some point a medical professional told them to purposefully get pregnant to stop their symptoms.
It will cure your problems, overlooking the fact that endometriosis can cause infertility. So is that not the most insensitive thing you could possibly say to somebody? You already are miserable. Don't then remind me.
Statistically, 30 to 50% of women with infertility have endometriosis. The considerable scarring, blocked fallopian tubes, and damaged ovaries that come hand in hand with the condition play a large part when it comes to difficulties conceiving.
When you have to have that conversation with your partner after for so long you've been together, and you have to sit down and say to them, I'm really sorry, I might not be able to give you a child, it's so upsetting, because you feel like you're letting them down. Not yourself, it's them that's part of you now.
But Rochelle was one of the lucky ones. She now holds the proud title of mummy to a boisterous little boy called Noah. But this family's journey has been far from an easy ride. Endometriosis doesn't just physically impact the body. The mental health impact can be just as severe, particularly when it comes to the strain it has on relationships with your family and friends.
I do blame myself 1,000%. I mean, it does impact my life massively, but it also impacts my son's life, my partner's life, because they have to deal with it. They have to deal with the tears that I go through, the pain that I go through. They're the ones that pick me up, and if I didn't have them in my life, I don't know where I'd be. Because I've got Noah, I have to be strong for him.
Rochelle was hospitalised less than a week after speaking to me because of an endometriosis flare-up. She's now awaiting her third laparoscopy in just 6 years. The ugly truth is, women are leaving doctors' appointments feeling unheard and alone. They're turning to support groups online to meet others in the same position as them. The most difficult thing about these support groups in particular are just how many times you see the same scenario play out across the country. It's clearly a widespread issue. From women whose doctors tell them that their pain isn't real and it's all in their head, to those who are funneling their lifelong savings into private treatment, simply because after years of dealing with pain, they're no closer to receiving a real diagnosis. It's no wonder why women are turning to each other in the hour of need.
She has put me on the urgent surgery list for a laparoscopy due to being left with this for so long. My bowel, bladder, uterus and left ovary have all joined together. No wonder I've been getting so much pain in my left side.
My boyfriend just said to me, "Great, I'm 23 and no sex life," because I explained to him it hurts so much to have sex. I didn't say anything and left the house. Ladies, I feel like a failure. I feel like he should understand, and half the time he does. I understand he's a man and has needs, but why do you have to make me feel like I'm worthless?
Hey all, I'm 20 and my current, along with my old gynaecologist, have recommended I get a hysterectomy. Has anyone had one this young? What was it like? I'm really nervous and uneasy about it. I'd love to have kids of my own someday, but I don't think that's ever going to happen, and it's heartbreaking.
One person who really understands what it's like to be part of the online endo community is Miranda Burns, who shares her health journey on social media. Her endometriosis has left her with severe damage to her reproductive organs, so much so that one doctor told her she was her very own brand of contraception. Against all odds, Miranda and her fiancé fell pregnant naturally last year. For them, it was some of the happiest days of their lives. But almost halfway through the pregnancy, their hearts were broken when they lost their baby girl, Amber Lee. Doctors were never able to confirm whether the damage caused by Miranda's endometriosis was the reason that Amber Lee stopped growing.
You could torture yourself, like thinking, oh, what if that doctor specifically back then had taken me seriously? What if someone had thought to do an internal scan 5 years previous? We could have seen this and we could have damage controlled. But, you know, that's just a really dark path to go on if you think like that. So we're trying just to sort of look forward rather than blame necessarily. But I do still hold a lot of resentment towards the doctors that palmed me off.
The journey to an endometriosis diagnosis is difficult. It's hard on the body and on the mind, but for those dealing with chronic pain every day, it's well sought after. Ultrasounds are used as the first step to diagnosis. Depending on how severe the endometriosis is, a doctor can sometimes see it on a scan. But the only way to correctly diagnose a patient is through a laparoscopy. This keyhole surgery can be very invasive, and all before even knowing what's actually wrong with you. On average, it takes 8 years and countless doctors' visits to receive a firm diagnosis.
And as a clinician, I think it's quite frankly embarrassing that we're still having this conversation. And I think it's perhaps as women culturally, irrespective of our different backgrounds, we sort of accept the fact that it's okay to have painful periods, and maybe you're a bit too stoical about it and we just get on with it. And often I think when you sometimes see clinicians who may not have an understanding of endometriosis, they try and trivialise it.
Endometriosis isn't a rare condition, but the uncertainty around diagnosis leaves patients feeling isolated and scared. So why are women having to wait on average 8 years to finally get the diagnosis that they've been so desperately searching for?
There's no simple diagnostic tool to actually diagnose endometriosis. So the only way to definitively diagnose the condition is through surgery. So doctors will automatically want to rule out other conditions first before signposting somebody for surgery.
But there have been some positive strides to shorten the diagnosis waiting time. The All-Party Parliamentary Group on Endometriosis recently unveiled a new report targeting the main areas of concern in endometriosis care.
Over 10,000 responses from those who have a confirmed diagnosis. We've got things like, so in terms of diagnosis, 58% have visited their GP over 10 times, 21% visited doctors and hospitals 10 times or more, and 53% went to A&E, and 27% went to A&E 3 or more times.
The APPG report has been well received by those in the endometriosis community. For many, it's the first time that they're seeing the government tackle this issue head on, but there has been some concern on whether it goes far enough. The main sticking point relates to a key recommendation laid out in the report. By 2025, the government aimed to cut down the diagnosis waiting time by 50% to 4 years. Now, on the surface, that does sound great, but for women with the condition, it means that they will have to deal with its debilitating symptoms for years before they receive the correct and appropriate treatment. Sir David Amos is the chair of the APPG on endometriosis. He explains the reasoning behind the 4-year recommendation.
So we felt we didn't want to get people's expectations up and then disappoint them. But if it can be done within 3 years, that's fantastic. If it can be done within 2 years, even better. So we went, you see, between 0 and 8, and we chose the point in between, which we thought was reasonable. There's not a quick fix to this, but we've promised the people who've responded to us in the survey that we're going to make sure that somehow throughout the United Kingdom there is a network of support for.
I contacted NHS England to ask about endometriosis care, but they were unable to provide a comment. Endometriosis is a condition without a cure, and although in some cases the pain can be mild, in most cases it's life-altering. The main way to control the condition is by managing pain levels. For many women, this means a cocktail of painkillers on rotation, and for others, trial and error with contraception.
I don't want to be on tablets for the whole of my life. I don't want to have to rely on medication to make me feel better. It's not a life that I want him to be around as well.
To tackle this issue, old technology has now been given a new purpose, in the form of a portable TENS machine.
Our mission is to end the unnecessary suffering of women everywhere. TENS devices have been around since the 80s. Like, why have I not heard of this? tried it, found it did work. Like, why isn't there options out there that are widely available for period pain? Like, you know, women have them in hospitals when they're giving birth, like physios are using them, but 90% of the female population, that's billions of women, don't have this available to them.
The reality is these women face a future of uncertainty, relying on painkillers to function as best as they can and turning to surgery as their only long-term relief.
Fear what comes in the future. I've felt my symptoms getting worse over the last few years. Certain things in particular are more of a problem than they were. So I worry about how bad it's going to get. But all I can do is, like, maintenance, is laparoscopies. That's all we've really got. So until they manage to find something which helps, which isn't just surgery, which is so serious in itself.
But there is some hope for those struggling. The future of endometriosis care in the UK is now in the hands of researchers at Oxford University. They're working on how to better signpost endometriosis in patients, to create more effective treatments and reduce diagnosis time.
It's really important that we understand these cells, because we know that the tissue is very complex and each of these cells will have a really specific role and function, and that will ensure that it functions properly in health. So then the questions that I'm really asking is, what happens in disease? Is there something that happens to these cells, or do they somehow change? Are they somehow different in endometriosis? And that would then lead to the development of the disease. So if we could really identify an endometriosis specific signature or a cell type, that could really help in the future.
As with all medical studies, this research will take time, and until it's done, there is very little to comfort this generation of women with endometriosis. They just hope that the care for the women who come after them will be different.